You're welcome to online lectures with Pharmaternity the Schoolboy. Today we'll take a look at pharmacology. Pharmacology, and the topic is routes of drug administration. Routes of drug administrations. Okay, let's start by defining routes of drug administration. What is route of drug administration? What is it talking about? It can be defined as a path by which a drug is taken to the body, either for diagnosis, prevention, cure, or treatment of various diseases and disorders. After formulation of drug into medicines or drug products or dosage forms, these medicines need to be taken into the system. So it's not just how does this medicine or this drug that is incorporated in the medicine get into the system to serve the purpose for which the drug is formulated. So this is done by taking it through a particular route into the system. So this path, we can call it path, through which this drug get to the system is what we call what? Route of what? Drug administration. No, if the knowledge of human body or the body of organisms is important to be able to know the right route through which the drug can get into the system without being destroyed, without being damaged, and and get to the system intact without losing any amount of the given dose or administered dose. Okay, now, so if the drug get to the system, if the drug fails to get to the system, what happens? The purpose, the therapeutic effect will not be felt. There will be no therapeutic effect because the drug did not even get to the what where it should work. Okay, so very important we understand this. It's very important we understand this. Now, this will take us to another aspect of this topic. The next question we should ask ourselves is this. There are What are those factors? What are those things, or we call them factors, that need to be considered or that influence the ability of this drug to get to the what? Site of action. What are the factors that influence or that influences the choice of route of administration of a particular drug? There are some drug you will see, this drug should be taken orally. This one should be applied on the skin. This one should be injected. This one should be inserted. This one should be inhaled. This one should be sprayed, either as nasal spray or what have you. You don't just wake up and choose anyone that comes to your mind. There are factors that determine the choice of the one to use for a particular drug and for a particular location, disease, or for a particular ailment. So there are the factors that helps in taking such decision. These are the factors we are going to look at now. So this will take us to factors that influence the choice of route of administration. Okay, the first one I want us to look at is what? The condition of the patient. Is the patient conscious? Is the patient unconscious? Is the patient vomiting? If a patient is unconscious, you don't need any drug that you administer through oral route. It may not work. It may not work unless you are using feeding tube, which is not even, you cannot just do at home. Not is this what you do in serious condition? Maybe it's a patient in ICU. Maybe you feel like switching to oral medication, or maybe you want to feed the patient. You can start using feeding tube, but this is not what you just practice at home. So it's not even ideal for a patient that is unconscious. The person is not conscious enough to swallow tablet or to take syrup. So anyone that is passed through the oral route may not is not advisable for patients in such condition. Have you now seen how the condition of the patient now determines the route through which you can route of administration of that particular drug? And also, patient that are vomiting. A patient that is vomiting, you don't need to administer any drug. That will go through the oral route. So this patient now needs something like injection, depending, or even infusion, depending on the nature of the drug. So the condition of the patient is very important. Another one is what? The physical chemical properties of the drug. The physical chemical properties of the drug. Moving from the inherent properties of the drug and the forms. When I say drug here, I'm not just based on the drug. I'm talking about both the drug and medicine itself here. Is it in solid form? A medicine that is in solid form cannot be be injected as solid. Is it compressed? Let's say compressed form. So a drug that is a patient that needs a patient, the nature of this drug, this medicine comes in tablet form, and is not sterile, and there are other things that that require for a sterile formulation that they did not keep to, and it comes in tablet form. You cannot just use it, start administering tablet form, a drug in tablet form, in as injection. It will not work. You may say, okay, let me grind. If you grind it and dissolve it, it will still not work because it was not prepared for such routes. Okay. Okay, you say, okay, this drug now is in liquid form, like syrup. You see now, syrup cannot go as suppository because it cannot be inserted. Remember I said, if you are talking about drug itself, it's quite different from medicine. And I'm just having a general overview of the physical chemical properties of the medicine itself, not just the drug. How the form it comes, how determine how the route you pass through. Then going to the drug itself, there are some drugs that cannot withstand the effects. What happens in the stomach, the gastric juice, we destroy them. So if you want to formulate them, you will not formulate them as medicine that should pass through the stomach. They will get destroyed. There are also some that when they pass through the liver, we call it first pass metabolism. The liver will destroy greater percentage of them. So if you want to formulate a drug, you also try to avoid such drug as the dosage form. You also try to avoid the 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 effect on the liver. So they will avoid anything that has to do with passing through the stomach, because once they enter the stomach, they must get to the liver. Have you now seen how this the physical chemical properties of this particular drug and medicine now, because I combine two of them, can determine the choice of what route of administration? Okay. The next one is the site of the desired action. The site of action is very important. If the site of action is localized, if the site of action is generalized, By localized, we call it local action. By generalized, we call it systemic action or action. So if the site of where you want that drug to act, if this just a spot, localized spot, things like topical application, maybe the point the spot is here. Will you go and start giving what will pass through the whole system and start having side effect inside the system before you start curing what is here? Simply apply that the cream. If it's cream, if it's antibiotic, you are seeing it. If it is antiviral, if it is viral infection, if it is fungal infection, you are seeing it. Get antifungal cream and apply at this spot. It will go. You must not necessarily start using the one that you will inject or the one that you will swallow. It will pass through all those processes before it start acting. Unless it's situation whereby you use the topical one for a long time, it didn't work. If you are sure that is the organism you are fighting, you can take either the one you swallow. It may work with the topical one and take care of the effect. There are some of these eye drops, nasal spray, eardrop that you just apply in that localized area. So we call this also. Have you not seen how the sort of action now determine the route of administration you use? It will also inform those that formulate the drug, the nature of the dosage form. They will formulate. I mean, those that formulate the medicine. Okay. Okay, let's continue. The next one, if the one you are looking for is if the drug you need look at if the site of action is not local, let's assume that our cannot be reached easily. Yes, there's some sort of action that you cannot be reached easily. That's the right word. That is unreachable. How will you now get to that point for the drug to act? Maybe that thing is in the brain. The issues in the brain. It's in the let's say yes, it's in the brain, in the central nervous system, yes, and maybe it's in the maybe something like septicemia. Where will even you cannot get a local acting drug for such. You need a systemic drug that will enter the system and pass through the system. So you swallow the medicine or you inject. If you swallow, it will disintegrate, dissolve, absorb, and get distributed through the blood to start fighting those microorganisms. If it is if it's one that if it is a pharmacodynamic agent, it will go straight to the receptors where it should work. Have you seen that it's not what you can just treat via local remedy, maybe local actions. So have you now seen how the site of action can determine the route of drug administration? The next one I want us to talk about, even though I've mentioned it, the effects of digestive juice and first pass metabolism on the drug. I have explained this before now. When I was talking about the physical and chemical properties of the medicine and the drug. Yeah, there's some drug that once they get to the stomach, they will get destroyed. They will be destroyed by the gastric juice. There are some drugs when they pass through the stomach, get to the liver, they will also be destroyed. We call it first pass metabolism or first pass effect. Such drug you don't need to administer them through oral route. Because if you do that, they will be destroyed unless you start using maybe if you want to avoid the stomach, maybe, but that one, for you to avoid the stomach, the drug must be acting down the small intestine before it can pass through the stomach intact. You start talking about enteric coating, where you now start designing it, formulating it in such a way that it will pass through this and get to the small intestine that is alkaline before it can now disintegrate. I'm taking us deeply into pharmaceuticals dispensing. Let me not, this is pharmacology. Let me not go too far. Okay. All right, let's continue. So the next one, accuracy of the dosage required. There are some, there are some, there are some, there are some route of administration that is the amount you administer that will appear in the systemic circulation. We call it 100. We say 100% bioavailability. The amount that is available in the bloodstream after administration. The is a ratio, is a percentage of the amount of your drug that get into the system circulation after administration. Now, things like IV, intravenous route, we deliver we make the drug bioavailable 100% in the system. It will make the drug bioavailable 100% in the system. So if you want accuracy of dose, inhalational inhalational is also there, but the highest one is what? Intravenous, 100%. So intravenous, now if you want accuracy of dose, you are sure that the patient need this drug now. The patient need the drug intact without losing any amount. If you say you are giving 100 milligram, that is 100 milligram you are giving to the patient. You are administering to the patient. IV is the best route. Have you now seen how the accuracy of the dose influence the what? The route of drug administration. Okay. The next one I want to talk about is what? How fast is the response needed? A rapidity with which the response is desired. Maybe in emergency cases, you want this drug to start acting immediately. You want this drug to start acting immediately. The patient is in a critical condition that needs emergency action, emergency effect. You choose a route of administration, things like IV. IV will give you this, the effect is seen instantly. It doesn't waste time because all those processes, other route of administration we take, that one will just go straight to the point and carry out the action and carry out the action. So these are the different routes of drug administration. Excuse me. I these are the different these are the different these are the different factors that influenced the choice of route of drug administration. Okay, please, before we continue, please, if you are new on this channel, please subscribe to my YouTube channel. If you are watching this on YouTube, please subscribe to my YouTube channel. Just click on the red button written subscribe and click on the bell like button by the side. That is a notification button, so that anytime we upload new lectures, you'll be among the first to watch. Then on Facebook, just click follow on Facebook so that you follow me on Facebook too, because I drop my full videos on Facebook and YouTube channel. The name is Pharmaternity the Schoolboy TV. Sometimes I also drop sometimes on TikTok, depending on the length of the video. My TikTok name is also at username is at Pharmaternity the Schoolboy. And God will bless you as you do so. Okay, so in our next class, we go over to the classification of the routes of drug administration. We go over to the classification of the routes of drug administration. Thank you very much for your attention. God bless you.